Congress is set to return from its August recess in a little more than a week. Tense health care town hall meetings have been the hot story during their time off. Not really time off, but a time at home. Will these protests reshape the debate when Congress is back here in Washington? Democratic Congressman Gerry Connolly of Virginia is a member of the House Budget Committee and joins us now live. Thank you.
Great to be with you.
Oh, well, let me ask you, did you have town hall meetings? How did they go?
I did, and I'm having some more. It went great. We had a town hall meeting just last week that has been covered by your network as well as some others, and it was a very civil, respectful dialogue. There was, points of view on all sides of the issue, but people actually, instead of shouting people down, people actually respectfully listened to each other, and I think we all learned a lot collectively, and it was very helpful to me as a member of Congress who's still undecided on health care legislation.
Anything you picked up from your constituents that have helped you lean one way or the other on some of the hot points of the reform issues?
Well, the first thing you have to do is sort of get through misinformation. There's a lot, are there going to be death panels and silly things like that that are obviously not true, but unfortunately have been propagated and have planted seeds of doubt. So if you can sort of establish one common set of facts, then we can have a dialogue about, well, what, if anything, needs to be done. I think there's common ground, certainly in my constituency. Healthcare is broken and getting worse, and it's not sustainable, the path we're on. The question then is, what do we do about it? And I think, most people favor a meaningful basket of reforms. Most people agree we have to get down long-term costs, but we want to make sure that we preserve the private insurance system we have now. Absolutely. We want to make sure we preserve the federal health programs that do exist, like Medicare, veterans benefits, TRICARE for military, that are very popular and work very well. So as we move forward, we have to take cognizance of those factors, and certainly that's going to have a big influence on how I vote.
Well, you mentioned keeping private options alive, private industry, but the public option, of course, has been one of the most heated points for a lot of folks at these town hall meetings. We know all three versions of the House legislation have the public option, and a number of members have stepped forward to say if you strip it out, you're going to lose maybe even 100 votes on the House side. Can you tell us where you stand on that right now?
First of all, I agree. I think, frankly, having a public option in the House version certainly is the difference between passing and not passing a bill. There has to be a public option if you want to get to any chance of a majority in the floor of the House. I think this has been just sort of the whole discussion overblown. It's not a matter of theology. And there's been a lot of misinformation about what the public option is. It's just that, an option. You never have to choose it. No one's going to force you to use it. It is, however, going to provide competition to insurance companies, which is precisely why the insurers have spent a lot of money trying to make sure there is disinformation and people hollering and shouting and trying to defeat it because they don't want the competition.
All right. We thank you for sharing your experience that you've had so far with the town halls. We look forward to hearing more for those you have remaining.
Invite me back. Thank you, Shannon.
And we'll see you back here when it all kicks up again in a week. Thank you, sir.